So, hello viewers, we have Dr. Saurabh Gupta with us today. And how are you, sir?
Yeah. Hello.
You're doing great? Of course, you must be. You're the doctor here. So, today we'll talk about digital health with Dr. Saurabh Gupta and we would shed light upon a few topics. Primarily, sir, I would like to ask you about what do you think is the role of a biomedical engineer in digital health since you're a biomedical engineer?
Right.
So, you would have to answer this cleverly.
Yeah, definitely. Okay, good. Good. So, as a biomedical engineer, our role is to maintain the right homeostasis of a human body.
Right.
And I think the best measure could is like we can get is by the help of digital health. So, if we can get a good diagnostic, like good diagnostic tools, and through digital health, obviously, maybe at remote locations or maybe at extreme locations. So the better diagnosis of the disease can have, like we can doctors can do the better diagnosis of the disease.
Right.
So yeah, as a digital, so as a biomedical engineer going into a digital health, I can work on technologies which can help me to take the data remotely, to take data healthcare data for like in extreme conditions, using all the communication tools, using telemedicine technologies.
Of course.
And emerging technologies. So yeah, this is something we can do.
Sir, I have also worked in hospitals and I have seen you biomedical engineers are so clever with the machines. The MRIs, the CT scans, all the time they get fed up of those machines. The doctor doesn't understand technology of those machines.
Exactly.
And you at the time, you come up suddenly from somewhere and you are like, I'll get the MRI machine from there.
So as a teacher also, to motivate biomedical engineers, I'll say that biomedical engineers are somewhere who are between God and doctor. Fine.
Right.
So in the sense, like when a doctor says that okay, let it be like on ventilator, a person should be on ventilator.
Right.
And other side there is God.
Right. So you are the one handling the
So
ventilator
biomedical
altogether.
engineers are the one who are handling the patient.
That was a very great answer, sir. So since you talked about shifting into the remote areas, right? So what the knowledge that I have this on this is like 40% of the people live in the urban areas, rural areas, and 60% of the people live in the urban areas, right? Similarly, the technology shifted upwards, backwards, right? 60% of technology is in urban areas and 40% of the technology is in rural areas, right? So how would you get to the rural areas, the people from there?
So yes, definitely, digital health is one thing. Uh, if we can develop the right technology, when it comes to uh, remote diagnostics using digital health,
Right.
that way we can penetrate the rural area,
Right.
rural health. But again, what I have seen, particularly in such areas, the people are not very much comfortable with technology.
Right, of course.
They want the doctor to touch them and to have a one-to-one conversation. So that is something has to be sorted out.
So changing the mentality is the need of the hour.
Right.
Right. So changing the mentality of the Indian population definitely will require time. And so the more question that I'll ask you in the series would be, uh, what is the emerging technology in digital health nowadays? Like we have talked about many other things, blockchain, 3D printing, IoT, Internet of Things. Apart from that, imaging is also nowadays at its boom. Like people are moving towards digitalization and imaging. So how would you shed a light upon this?
Right. So when it comes to emerging technologies, few things that we can see as of today that are happening is 3D printing.
Right.
So it's like in digital health, when like a fracture, it like gets a fracture, then we can develop that 3D printed prosthetics.
Right.
Okay, so that is happening right now. Somewhere like virtual reality is also like it is in practice as of today at some parts. So we can help with people at remote locations uh, to mitigate the or to handle the disease like psychologically. So like it happened in the COVID also.
Right.
At some areas. So these are few things that are happening, and I think in future that will bring a big impact. And let's hope
I hope for the best
everything
too.
will go.
I hope for the best too. And since you talked about COVID 19, that was seriously a very bad time for all of us. So how do you think after COVID-19 the era of digitalization is going? Like, is it at boom or is it downfalling?
Yeah, as of I think the digital technologies got really a good boost
Yeah.
during COVID, like in every sector, education, health, everywhere. So in health, in a pandemic like COVID, when even the doctor was not allowed to have a human kind of interaction with the person, these digital tech VR, AR, and these things have really helped a lot.
Right.
So, and the new areas have emerged out of that, which I think not many people have thought of before also.
Of course, of course.
And so yeah, it is helping.
Like I also saw many other things. Telemedicine was added boom. Many in apps
Right.
like which were not even thought of before the COVID
Exactly.
went to a boost via COVID. But after the COVID, telemedicine went down dramatically. I do not know why.
So the reason is, yeah, people will come to their ground state.
Of
So
course.
that is something. But still, like we have got some understanding. It's not like everywhere, because there are few things that have been sorted out by telemedicine, and at least the people have got, means, as I told earlier, that people were aversive when it comes to technology.
Adoption of technology,
Adoption
right.
of technology has happened a bit more after COVID.
So that was all. So this was Dr. Saurabh Gupta with us. He was very helpful for all the viewers. And the last thing I want to say you is stay healthy. Thank you.